Today, we're looking into a health topic that affects many elderly individuals, the signs of mini-strokes, also known as transient ischemic attacks or TIAs. These mini-strokes might sound less serious, but trust me, they're major warning signs. We often brush aside subtle changes in our health, especially as we age, but ignoring these signs can have serious consequences. So let's break down the 8 silent signs of mini-strokes that you should never ignore. Sign number 1. Sudden numbness or weakness, particularly on one side of the body, is a major red flag and often one of the first noticeable signs of a transient ischemic attack, TIA, or mini-stroke. This weakness or numbness can occur in the face, arm, leg, or even all 3 areas simultaneously, and it typically develops without warning. For example, a person might suddenly find it difficult to smile, notice that one side of their face feels droopy, or struggle to lift an arm or leg. They might also feel a pins and needles sensation, a complete loss of feeling, or a sudden heaviness that makes movement challenging. This symptom arises because a TIA occurs when there is a temporary disruption in blood flow to a part of the brain. Since different areas of the brain control different parts of the body, the specific side and location of the numbness or weakness often correspond to the affected brain region. For instance, if the right side of the brain is involved, the left side of the body may exhibit these symptoms, and vice versa. What makes this symptom particularly concerning is that it can be easy to dismiss, especially if it resolves within a few minutes or hours. However, even if the sensation or weakness disappears, it is a critical warning sign that should never be ignored. A TIA is often a precursor to a more severe and permanent stroke, so seek immediate medical attention to help prevent future complications and allow for early intervention. Now let's move on to the second sign, sudden confusion or trouble speaking. This symptom often manifests as difficulty understanding what others are saying or struggling to form coherent sentences. It's like your brain knows what it wants to say, but your mouth can't keep up. A person experiencing this may suddenly slur their words, speak in a way that doesn't make sense, or find themselves unable to recall simple words or phrases. Others may notice that the individual seems disoriented, unable to follow a conversation, or responding inappropriately to questions. This occurs because a TIA can disrupt blood flow to areas of the brain responsible for language and communication, such as the left hemisphere. Depending on the specific region affected, the person may experience expressive aphasia, difficulty speaking, receptive aphasia, difficulty understanding language, or a combination of both. This sudden and temporary breakdown in communication can be frightening and confusing for both the individual and those around them. Importantly, these symptoms might last only a few minutes or hours, making it tempting to blame it on stress or fatigue. However, even if the confusion or trouble speaking resolves on its own, it is a warning sign of an underlying problem that requires urgent medical attention. Like other TIA symptoms, this is not just a temporary inconvenience, but a serious indication of a heightened stroke risk. Acting quickly can ensure timely evaluation and reduce the likelihood of a future, more devastating event. The third sign we're going to cover is sudden vision problems. These may include blurred vision, double vision, or even temporary loss of vision in one or both eyes. A person experiencing this might find it difficult to focus on objects, notice that part of their visual field seems dark or missing, or feel as if their sight has become strangely distorted. These issues often appear without warning and can range from mild to severe, affecting daily tasks like reading, walking, or recognizing faces. Sudden vision problems during a transient ischemic attack occur because the temporary interruption of blood flow affects the parts of the brain responsible for processing visual information, such as the occipital lobe or the optic nerves. For example, if a blood vessel supplying the back of the brain is involved, the person might experience a loss of peripheral vision or a curtain effect over one eye. In some cases, they might not even realize their vision is impaired until they attempt to perform a visual task. Because these symptoms can resolve quickly, they're often mistaken for eye strain, fatigue, or even aging. However, sudden vision changes should never be ignored, as they are a significant warning sign of a potential mini-stroke. Sign number 4, dizziness or loss of balance. Feeling a bit unsteady? Don't brush it off. Sudden dizziness or difficulty maintaining balance can be a key indicator of a mini-stroke. This may manifest as a spinning sensation, also known as vertigo, trouble walking in a straight line, or an inability to coordinate movements. A person might suddenly feel lightheaded, stumble, or need to grab onto something to avoid falling. These symptoms occur because a TIA can temporarily disrupt blood flow to the areas of the brain responsible for balance and coordination, such as the cerebellum. Depending on the severity of the disruption, the person might experience mild instability or a complete inability to stand or walk without assistance. Some may also feel nauseous or disoriented, compounding their discomfort. It's easy to dismiss these signs as dehydration, fatigue, or clumsiness, especially if the symptoms resolve quickly. However, sudden dizziness or loss of balance, particularly when paired with other symptoms, is a warning signal that should never be ignored. Sign number 5, severe headache. A sudden, intense headache that feels unlike anything you've experienced before can be a warning sign of a mini-stroke. This isn't your typical headache or a migraine. It often comes on abruptly and may feel like a sharp throbbing or overwhelming pain. Some people describe it as the worst headache of their life. In some cases, it might even be accompanied by other symptoms such as nausea, vomiting, dizziness, or confusion, making the situation even more alarming. It's easy to dismiss a severe headache as stress, dehydration, or even a migraine if you're prone to them. But if it comes on suddenly and feels unusually intense, it should never be ignored. Unlike typical headaches, those associated with a TIA are a red flag for an underlying vascular issue that could lead to a more serious stroke. Immediate medical attention is crucial to determine the cause and take preventive measures. The sixth sign we're going to discuss is difficulty walking. A sudden inability to walk properly, characterized by staggering, stumbling, or feeling like your legs won't cooperate, can be a sign of a transient ischemic attack, TIA, or mini-stroke. This symptom may also present as a feeling of heaviness or weakness in the legs, making movements clumsy or unsteady. These walking difficulties arise when a TIA affects the parts of the brain that control coordination, balance, or muscle strength, such as the cerebellum or motor cortex. You might notice an unsteady gait or a sensation of losing control over your legs, even if you were perfectly fine moments earlier. For some, this can feel like the ground is shifting, while others may experience sudden jerky movements they can't control. This sudden onset of walking difficulty, especially without an obvious cause, is not just a minor inconvenience. It's a clear signal that something isn't right within the brain's complex systems. Another symptom of a transient ischemic attack is difficulty swallowing, also known as dysphagia. This symptom involves a sudden inability to swallow food, liquids, or even saliva, and can also lead to coughing, choking, or the sensation that something is stuck in the throat. In some cases, individuals may feel as though they're unable to coordinate the muscles needed to swallow properly, making it difficult to eat or drink without discomfort or risk of aspiration. Dysphagia occurs when a TIA temporarily affects the areas of the brain responsible for regulating basic functions like breathing, heartbeat, and swallowing. Once a TIA affects this area, it can impair the communication between the brain and the muscles that control the throat, mouth, and esophagus, leading to difficulty in swallowing or even an increased risk of food or liquid entering the airway, which can lead to choking or pneumonia. People experiencing sudden swallowing issues may also find it harder to control their speech, as the same muscles involved in swallowing are also used for talking, like we have already mentioned before. This can create a double challenge: difficulty eating and speaking, which could lead to frustration, embarrassment, or anxiety. While the symptoms may be temporary and resolve on their own, difficulty swallowing is a serious sign that should be addressed immediately, as it indicates that the brain's ability to perform essential tasks is compromised. Recognizing this sign as part of a TIA is critical in getting medical help as soon as possible to minimize the risk of a more severe stroke or long-term complications. So don't ignore the signs your body is giving. Finally, let's talk about sign number 8, temporary memory loss or confusion. This symptom can appear as an inability to recall recent events, difficulty recognizing familiar people or places, or feeling disoriented about time or location. A person experiencing this may suddenly forget what they were doing, lose track of their surroundings, or struggle to follow a conversation or instructions. This happens when a TIA affects regions of the brain involved in memory and cognitive function, such as the hippocampus or frontal lobe. The disruption in blood flow temporarily impairs the brain's ability to process, store, or retrieve information, leading to moments of blanking out or mental fog. Unlike gradual memory lapses, the onset is abrupt and can be distressing for both the individual and those around them. While the memory loss or confusion may pass quickly, it often leaves a lingering sense of unease or frustration. Recognizing this sudden and unusual cognitive change is crucial, as it signals a serious issue with brain function that requires attention. So there you have it. 8 major signs of mini strokes in the elderly. Remember, these signs can be subtle and easy to dismiss, but recognizing them early can make a world of difference. Being aware of these signs can help you act quickly and seek medical attention, potentially preventing a more severe stroke. Share this video with your loved ones to spread awareness and potentially save lives. Knowledge is power, and by being informed, we can all play a role in protecting the health of our elderly loved ones. Don't forget to like and subscribe for more tips and information. See you next time.